Coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. WHO will continue to provide updated information as soon as clinical findings become available.
What are the symptoms of COVID-19?
Symptoms can include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be fatal. These symptoms are similar to the flu, influenza, or the common cold, which are a lot more common than COVID-19. This is why testing is required to confirm if someone has COVID-19.
How does COVID-19 spread?
The virus is transmitted through direct contact with respiratory droplets of an infected person, generated through coughing and sneezing. Individuals can also be infected from and touching surfaces contaminated with the virus and touching their face, e.g., eyes, nose, mouth. The COVID-19 virus may survive on surfaces for several hours, but simple disinfectants can kill it.
Who is most at risk?
We are learning more about how COVID-19 affects people every day. Older people, and people with chronic medical conditions, such as diabetes and heart disease, appear to be more at risk of developing severe symptoms. As this is a new virus, we are still learning about how it affects children. We know it is possible for people of any age to be infected with the virus, but so far there are relatively few cases of COVID-19 reported among children. This is a new virus and we need to learn more about how it affects children. The virus can be fatal in rare cases, so far mainly among older people with pre-existing medical conditions.
What is the treatment for COVID-19?
There is no currently available vaccine for COVID-19. However, many of the symptoms can be treated and getting early care from a healthcare provider can make the disease less dangerous. There are several clinical trials that are being conducted to evaluate potential therapeutics for COVID-19.
How can the spread of COVID-19 be slowed down or prevented?
As with other respiratory infections like the flu or the common cold, public health measures are critical to slow the spread of illnesses. Public health measures are everyday preventive actions that include staying at home when sick with COVID-19 symptoms and call COVID-19 helpline of your country for quick assistance, cover mouth and nose with face mask when in public space, covering mouth and nose with flexed elbow or tissue when coughing or sneezing. Dispose of used tissue immediately, wash hands often with soap in a running water for up to 20 seconds or use alcohol-based hand sanitizer in the absence of water, Use it at home as advised by the government to save a life. To maintain 6 feet or 1.8 meters minimum social distance. You avoid social gatherings or meetings. You avoid handshaking, hugging, kissing, etc. You avoid staying in crowded areas, cleaning frequently touched surfaces and objects. As we learn more about COVID-19, public health officials may recommend additional actions. Hello friends. Coronavirus is real. Play safe, stay safe, sit at home when advised by government or healthcare experts to do so. Call for healthcare help whenever the need arises. Finally, stay at home. Save lives. Help stop coronavirus. Take note of these 5 measures. 1. Stay home as much as you can. 2. Keep a safe distance. 3. Wash hands often. 4. Cover your cough. 5. Sick? Call ahead. This is the racing bar chart for the ranking of top 10 countries with very high rate of COVID-19 infection in the last 60 days. This is the racing bar chart for the ranking of top 10 countries with the highest death rate of COVID-19 in the last 30 days. Thanks for watching. Please subscribe to my channel for more interesting videos and updates on COVID-19 pandemic.